A very warm welcome to all of you to Ayurvedic Healing and Beyond podcast, and this is your host Dr Vignesh Devraj. In today's episode, we're going to discuss about one of the Panchakarma therapies called Nasyam. When we were four-legged animals, while walking, gravity helped us to cleanse the nasopharyngeal duct. Because when we were walking, because our nose, right now we are standing on two legs. So anything that goes inside your nose, it has a tendency to enter your system. But when we were four-legged animals, because of the nature of gravity, the nasopharyngeal duct was facing towards the earth. So ability to cleanse with the power of gravity was easier for the nasopharyngeal duct. But once we started walking on 2 feet, what happens? Anything that you inhale, if it is not filtered through your nasopharyngeal duct, there are multiple hair follicles and the pores that helps to protect this. This can enter your system. That's why just a few years ago, the RT-PCR test, the nasal swab was used to detect the viral load in your body. Either they test your throat or to your nasopharyngeal duct. They put that swab through your nose and to see what is the viral load. Because nasopharyngeal duct is one of the areas where a lot of bacterial or microbial load can get stuck. And if we do not clean that area as often, like today we are obsessed with washing hands. And in Ayurveda it is mentioned, cleaning your nasopharyngeal duct is as important. Because this is where a lot of microbial load can go and gets stored there. Because today we are walking on 2 legs. So that's why Nasyam is also a part of Dinacharya, that is a daily rituals, and it is also part of Panchakarma. Like there is a slight difference. The Nasyam that is mentioned in Dinacharya, which is on your daily rituals, is a milder version. We call it Pratimarsha Nasyam. You are pouring, there are certain oils like Anutailam, Shadbindu Tailam. Some people just use salt water. Now I will also come back to the difference between Neti and Nasyam. But sometimes people use salt water. When you use that, what happens is it cleanses your nasopharyngeal duct, and it's like, using a hose and pushing water through that part, and it cleanses the whole thing. And whatever is the mucus or whatever is the mucus crusts that are left over, or if there is any toxins when you are getting exposed to certain, when the air quality index is bad, when this goes and gets stuck, by doing Nasyam, we are helping to release that. So the Pratimarsha Nasyam is few drops, and the Nasyam that we mentioned in Panchakarma, maybe the drops can be even up to 7 to 8 drops, whereas in Pratimarsha Nasyam, you're adjusting 1 or 2 drops or even up to 3 drops. So the oil, one of the most commonly used oil for Nasyam is called Anutailam. And a little more deeper one is called Shadbindu Tailam. I highly recommend, please check with a doctor and then you can do that so you understand the difference. But Anutailam is something that is mentioned in Ayurveda that can be used on a daily basis unless you don't have any nasal issues that is contraindicated. Now, there are multiple areas where this can be helpful. Now, sometimes patients come to me with nasal blocks and they are having issues with deviated nasal septum. So many people are having deviated nasal septum. That's one problem that you see. But more than the deviated nasal septum, because of the high mucus load in their body, because they consume a lot of sugar, milk or alcohol that produces a lot of mucus in the body, this tends to go and starts creating a layer along the septum and makes it difficult for the person to breathe. So Nasyam, when you do a constant Nasyam therapy, it helps to open up and release those layers layer by layer. That is why Nasyam is so important today. And in fact, there is a sloka in Ayurveda, Nasa hi Shiraso Dwaram, which means the nasal pathway is the doorway to your brain. So when you keep your nasal pathway clean, it helps you to breathe better, and when you breathe better, it makes a big difference. And it's called your vital capacity. How deep is your ability to breathe and intake of oxygen? So when your breathing is struggle, when you're struggling with breath, like if you see sleep apnea is a big contributing factor to low energy, and in the long run, it can also lead to severe cardiac issues. So sleep apnea and most of this issue, when a person is able to do Nasyam, it's not that sleep apnea can be reversed with Nasyam. Definitely your lifestyle plays an important role. Exercise, eating healthy plays an important role. But Nasyam is a fantastic therapy that can help to minimize the mucus load, especially in the nasopharyngeal duct. And people who have tendencies of migraine or sinusitis, all this, if you look at it, it's a kapha related problem, excess mucus in the nasopharyngeal and the sinus region. When people do Nasyam on a regular basis, it helps to cleanse those channels and they are able to breathe well. They reduce the toxic load and they reduce the mucus load. And this helps them to breathe better. They become more fresh, alert. And you see, when you can breathe easily, that makes a big difference. Like one of the definitions of health, are you able to breathe easily and effortlessly and deeply? If you're able to do that, something about your health is quite good. I mean, this is just one of the parameters that you can look at. And Nasyam is one of those therapies that can be done. One of the best times to do Nasyam is upon rising in the morning, because that's also the time when the mucus load is very high. Like we say, the Kapha Kala is early in the morning. Like before the sun rises, you see the mist and you see the clouds, you see the fog. And once the sun rises, the fog melts away or the clouds melt away or the mist will go away. Same way in our body, the mucus load is tentatively higher in the early morning time. And at that point of time, if you're able to do the Nasyam, you're able to release it on a regular basis. Now coming back to Neti. Neti pot is also a fantastic, they use a Neti pot and pour water and they tilt the head and they pour the water and it comes out through the other nose. This is part of yogic therapies. Neti is also a phenomenal daily ritual that can be incorporated. However, Nasyam has a deeper cleansing process. You inhale that and you sometimes spit it through the mouth. Whereas in Neti, you're just using both the nostril as the in-between pathway between both the nostril. You're using it to push through the water so that it cleanses that part. But when you do Nasyam, you're also cleansing a good part of the nasopharyngeal duct. That's the difference here. Both are equally important on a regular basis, but Nasyam is a deeper cleanse, whereas Neti is more of a daily ritual that can be done to maintain your hygiene with your nasopharyngeal part. So just to give you a brief idea. And Nasyam can be done with oil, Nasyam can be done with salt water, and also there are Nasyam that can be done with powder. You inhale a certain powder and that will also clear up certain things, and some people, they tend to sneeze after that, and while sneezing they purge all the excess mucus and the toxins. These are some of the methods of Nasyam. And when people do Nasyam very well, their vision tends to improve, their breathing tends to improve. If they have tendencies of neck stiffness because of inflammations, this also helps to reduce. So when people have neck pain, headache, sinusitis, migraine, or any kind of allergies related with upper respiratory tract, or when their mucus related nasal blocks are there, Nasyam is an important therapy, and usually we combine it with steam inhalation. So we do a Nasyam and after that we make them to inhale steam, so that once the pathway is clear and when they inhale the steam, it opens up 1 degree further. So combination of Nasyam with steam inhalation plays an important role. This usually we do it when we do a proper panchakarma. It's a fantastic therapy that can be incorporated.